Hello, good afternoon, good evening, good morning, wherever you're tuning in from, and welcome to Facebook Neurology for Vets, our second in the series of our Journal Club seminars, webinars, where we have a recent publication talked about, discussed by the author themselves. And today it's our pleasure to introduce Dr. Koen Santafor and talk about his publication recently from last month, it looks like, from Vet Radiology and Ultrasound on vertebral vascular canal dysplasia in French and English bulldogs, talking about the imaging and the clinical characteristics. So thank you, Koen, for showing up here today and taking the lead in this journal club. We really appreciate your time with this. Just for everybody listening, Koen is a third-year European College of Veterinary Neurology resident at Evidensia Small Animal Hospital, Arnhem and Hart van Brabant, Waalwijk, Netherlands. Koen has given me lessons how to pronounce that, and I'm sure it's just made a mess of it. So I apologize to everybody from Waalwijk or who has friends in Waalwijk or family in Waalwijk. I keep saying it wrong. But anyway, welcome from Waalwijk. He has been passionate about veterinary neurology, including neuroanatomy and neuroimaging. And in the midst of his daily routine, those special patients that take up a bit more time have been an inspiration to him, leading to multiple publications in the form of case reports, series, and research projects by the neurology team and his international colleagues that Koen is proud to be working alongside with. So thanks to all of Koen's support team there at the Evidensia Hospital. And so we're going to talk about this recent publication, and you can talk about its origins and what you did during the study, Koen, and what its conclusions were. So really, great pleasure to have you here. Thank you very much.
Thank you. Just share the screen here. It should be working right now.
Yeah, it's working.
Great. Well, thank you very much for the introduction, Simon and Laurent, for this opportunity for me to present my work and the work of the co-authors mentioned here. I'd like to start off by thanking all of them, and especially also the support team at the hospitals, and of course my supervisors, Paul and Niklas, for their continuing support. And without further ado, I would like to start out with talking about vertebral malformations and anomalies in general. We know, of course, they are common in various breeds. Mostly screw-tailed dog breeds are reported, such as the French and English bulldog, but also pugs. Clinical relevance of those anomalies is variable. There are several publications focusing on these malformations, and we can see here one by Rodrigo, who's a co-author of this study as well, who presented a scheme for characterizing most of the types we see on a fairly common basis. But then we saw a case of an English bulldog with these images on the MRI scans, and we were all like, what is this? Because that doesn't seem to fall into any of the categories that were described earlier. And you can see on these images here with the circles around them that there are sort of like ditches or holes at the bottoms of these of the vertebral canal into the bodies. And on the transverse images, you can see that on T1 and T2 weighted imaging, these are the contents are hyper intense, and the shape is really odd, sort of in the center, below the spinal cord, going all the way through. And on STIR, we can see that these are hypointense, so that seems to all fit with that these contents are mostly fat. We also performed a CT scan on this case to further characterize the bony abnormalities. You can see several more aside from these strange things. These are post-mortem photographs of the affected vertebrae, and you can see here this hole at the bottom of the vertebral canal. So we saw the ditches in the bottom of the vertebral canal. Then we would like to describe that a little bit more. We should think about what should be there normally. And we can see that, there are several structures that are associated with those locations. And it's very important to have a grasp of the normal vascular anatomy and those in that area. And then you can see here on the side of the slide all the vascular structures associated with the spine and spinal cord, and especially the one in the center of those vertebrae should be the basivertebral vein, which is depicted on these images here, slightly larger than they are in real life, of course. So at that location where we saw those malformations, normally there should be a vertebral vascular canal, which is named differently in literature by these eponyms and other descriptive terms. You can see the Nomina Anatomica Veterinaria doesn't describe a name for it. So we opted to stick to vertebral vascular canal and thus call this anomaly vertebral vascular canal dysplasia. And there are images of the vertebral vascular canal in radiology books, and also post-mortem. You can see that these vascular canals can be either double or single. Here is an example of a double form with a bony bridge in between. And there's a description of a V-shaped, hardly noticeable in some images, but on the CT scan it's nicely imaged. And this can apparently be normal. We briefly entertained the idea of calling them Santifort holes, but refrained from doing so for obvious reasons. So the aim of our study was to describe the clinical CT and MRI characteristics of VVCD and estimate the prevalence of this anomaly and describe the characteristics thereof in a group of French and English bulldogs. It was a retrospective multi-institutional observational study, and the anomaly was defined as a defect in the ossification of the vertebral body of variable extent centered around the position of the vascular canal. We devised a scoring system classifying each of these affected vertebrae by two criteria: extent and characteristics, which I'll come to. And it was a two-part study. There is a description of clinical and imaging characteristics in canine patients with the anomaly, which I'll call the cases part of the study, and population prevalence estimation for the anomaly in French and English bulldogs, which I call the prevalence part of the study. So this scoring system we devised was based on two factors: extent, which could be classified as A, less than 50%, B, between 50 and 100%, or less than 100%, and C, 100% of the dorsoventral height of the vertebral body. And two characteristics, so it could be single, midline, or unilateral, or double, bilateral, or complex. So starting out as double and then converging into single, or having some kind of deviating shape. And you can see examples of all these categories in this image here, which is also included in the article, and you can look that up later. So the cases part of the study, we recruited cases retrospectively online. So we basically asked the veterinary neurology community, if you have seen such anomalies, please contact us. And cases were included if at least the entire thoracic vertebral column had been imaged with CT or MRI, and at least one vertebrae showed the anomaly. Clinical and follow-up information have to be present, detailed on the bottom of the slide, and should be accessible for review. And the presence of other anomalies or malformations was not regarded an exclusion criterion, which would be difficult in these breeds. We had to exclude all of them probably. CT and MRI DICOM files were included cases were retrieved and reviewed by me and in cooperation with two other specialists, Rodrigo and Marco. And all cases were scored using the scoring system I just explained. The prevalence part of the study, we looked at a UK population of English and French bulldogs scanned by CT of at least thoracic vertebral column, French and English bulldogs without neurological deficits recorded. These dogs were scanned between October 2010 and April 2017. The anomaly was scored, and sex, neuter status, and age data were recorded for analysis. The Italian population we included of English and French bulldogs were scanned with MRI. At least the thoracolumbar region of the vertebral column was scanned and French Bulldogs were scanned between April 2018 and December 2020, and the English Bulldogs between a longer period. And most were scanned with neurological deficits, mostly caused by intervertebral disc extrusion. We performed a statistical analysis, so we did descriptive statistics and a one-tailed Mann-Whitney test for the differences between the groups. So on to the results. You can see on the chart here where the cases were from. 9 cases were identified, 2 from the USA, 6 from the UK, and 1 from the Netherlands. They were all English Bulldogs, 5 male intact, 3 male neutered, and 1 female intact. Age ranged from 4 to 19 months, so a median of 12 months when these dogs were imaged. There were variable clinical signs in these dogs, related or not, probably to the anomaly. They all were scanned with CT, and 3 were also scanned with an MRI, including at least T2 weighted sagittal imaging and transverse T1 weighted sagittal imaging and STIR sagittal images. All cases had 5 or more thoracic vertebrae with the anomaly affecting more than 50% of the vertebral body height, so score B or C. The number of thoracic vertebrae with the anomaly ranged from 9 to 13, so all thoracic vertebrae in one case. And you can see here the table, which is included in the article. And case 1, you can see here an 8-month-old male entire dog, which had in which all thoracic vertebrae were affected by the anomaly, either with a low score, so a low percentage of the vertebral body height, or very severe or complete. And you can see here on this image, which contains CT images of varying quality, because they were recruited from all these different cases from different institutions. You can see examples of all these scoring criteria from this pictogram here into the real results of these patients. You can see that the anomaly, which we describe as variable extent and characteristics, which we tried to summarize into this classification system. So the anomaly was encountered in otherwise malformed as well as otherwise normal vertebrae, and in 5 out of 9 cases, it could have been clinically relevant, so either contributing to the occurrence of clinical signs or affecting clinical decision-making. So basically, if one of these patients was considered to be a surgical candidate for other stuff in the area, including stabilization procedures, of course, the presence of this anomaly would affect any implants going into such a vertebra. Which we also noted that although this study focused on thoracic vertebrae, this is a lumbar vertebra in B, which also has an abnormal vertebral vascular canal at the bottom. And there were other, also not that commonly described anomalies in other parts of the vertebrae. So these holes extended, you could postulate on just on basis on this image that it could be a bone cyst of something, but it seemed to extend linearly from front to back. So that was strange as well, but we didn't pay any further attention to that. MRI characteristics of all cases were basically the same as in this example image. So the contents of those dysplastic canals was consistent with fat. There's one postmortem case, which was the Dutch case. So there was fat inside. We didn't do a microscopical examination of the contents, which is a pity, but we were focused on the bony abnormalities at that point. So the results of the prevalence part of the study, the UK population first, which contains 36 English Bulldogs and 41 French Bulldogs without deficits. You can see the age ranges, but the most important thing in this table here, you can see that most of these included cases were male, which would affect our interpretation of the results. But as all these dogs were normal and were scanned for, I don't know what reasons exactly, we cannot conclude anything about a male predisposition or whatnot. Prevalence of the anomaly is the most important thing. We found it in 83% of English bulldogs and 68% of French bulldogs. And the number of thoracic vertebrae affected ranged from either 0 to 12, with a median of 6 for the male English bulldogs and 4 for female English bulldogs, and medians of 2 for the male and female French bulldogs, which seemed to have lower numbers of vertebrae affected, and this was also statistically significant, which you can see these tables here. So we see the medians and ranges of the affected numbers of vertebrae, and English bulldogs had significantly more affected vertebrae. Also, English bulldogs had significantly more vertebrae affected by the classification grade B or C, so more than 50% of the vertebral body height was affected more often in English bulldogs. So basically, English bulldogs seem to be affected more severely with this malformation. Regarding the Italian population, which consisted of 106 French bulldogs and 23 English bulldogs, most of them were scanned for subacute thoracolumbar myelopathies, most likely unrelated to the presence of the anomaly, of course, and at least T2 sagittal imaging and transverse imaging over the center of the lesion site were included. And we saw prevalences lower than in the CT part of the UK population. English bulldogs had a prevalence of 21% based on those MRI scans, and French bulldogs had 6.6%. So in all cases, other causes were found for the clinical signs. So on to the discussion of these results. Vertebrovascular canal dysplasia is a newly described vertebral anomaly in French and English bulldogs. Dysplasia means an abnormal development of cells and or organs, which is a form of dysmorphia. Dysmorphic features are abnormally formed body structures. And another example is those brachycephalic skulls, which is also a form of dysmorphia. Cases from various geographical locations were included, which is important because apparently this anomaly can be seen at least throughout these geographical locations we have described and included in the study. English bulldogs seem to be affected more often and more severely than French bulldogs. This should be corroborated by future studies on this matter. So about that Italian population, which included dogs scanned by MRI, they showed lower prevalences than the UK population. This is most likely affected by scanning them with an MRI versus CT. Likely we underestimated the prevalence in that Italian population. We could basically see more bony abnormalities with the CT. But why did we include these? Basically because we wanted to prove the prevalence of this anomaly in breeds in geographically distinct regions. And also, of course, to characterize the contents of those dysplastic canals a little bit better, which is more easily done with MRI. And this is just a recent case that Marco Bernardini saw in Italy, and he felt keen to share that with me. And you can see here that it's really striking that these anomalies, if you first take a glance at this, you think, why does this dog have so many intervertebral discs? But if you look closer, you can see that these white spots are right in the middle of those affected vertebrae. So what is normal? In some books it's mentioned that vertebrovascular canal can be imaged in normal dogs and has a V shape with a slight extension to the ventral side for the passage of those venous structures. So is that normal? Yes, that should be regarded as normal. But where is it normal? Is it normal in all vertebrae? That's not that well described. Mostly lumbar vertebrae are included in examples. Well, we know that these venous structures are, they're also necessary to dispose of the blood, of course. So they're probably normal in every location, but when is it not normal anymore? This is not definitively concluded in literature. In human literature, several characteristics of basic vertebral foramina or vertebral vascular canals are published. Clearly, at least in my opinion, this is not to be regarded as normal. So those B and C categories are really strikingly abnormal. You can dispute about the A categories, maybe a slightly bigger ditch than you would expect to see is not per se abnormal, but then again, we have to define what is normal before we can define what is abnormal. So we need more morphometric studies to characterize this. And maybe, of course, a breed would affect what is interpreted as normal in different dogs. A grayscale is likely present, is the most important thing to realize. So we would propose that if you're talking about this anomaly, so vertebral vascular canal dysplasia, you would at least consider that term for the dogs with scores of B and C. There is one study on vertebral venous plexus in dogs, which is CT-based, contrast-based, and that describes nicely that, and also shows in images that there are basic vertebral canals allowing for the passage of those veins. They do not necessarily talk about the canals themselves, but this is a valuable study. They describe lumbar vertebrae. We focused on thoracic vertebrae for these canal dysmorphias. In human literature, I'll just briefly go through this. There's a whole range of articles, really amazing. This is a recent one that describes all kinds of normal-ish holes at the bottoms of these canals, allowing for the passage of veins, which could be single, double, quadruple, you name it. And they also include images like this to describe what can be seen and are basically variations of normal. They include a lot of morphometric stuff, which I'll not bore you with, but yeah, it's amazing that that data is there, because that really helps in defining what can be regarded as normal, if there is a normal. So you can just be amazed with all these data and all these images that you can see here, which are really nice to know that they're out there. So why does this occur? Why does this happen? We do not know how embryologically the formation of these vascular canals is regulated. Could it be that there is a passive distension by the formation of the veins, and then the bone is resorbed around it? If they are excessively broad, is that because of the veins being dilated early in the formation? It is likely, however, to the opinion of me and the co-authors, that genetic and environmental factors play a role. There is some literature on hypoxia of the mother resulting in vertebral defects in mammals as well as in fish, which is interesting because if you think about it, these brachycephalic breeds can have chronic hypoxemia. Maybe that affects the embryological development, but that's hypothetical. So if we think about clinical relevance, what could we think about more than putting in implants? Human literature is full of that, and they describe that spinal fractures, these basic vertebral canals have a role in that. So if there is a fracture, it could be that the weak spot where those canals are positioned influences the development of fractures as well as their morphology. And it also seems to have implications if that canal is involved in the fracture, because it affects blood supply, because of the vein that's running through there. It might affect healing processes or a development of post-traumatic pain. And other stuff is that if you put in cement in these vertebrae, it could leak via those canals, it could embolize or otherwise affect the treatment. In our studies, we didn't link any neurological consequences directly, although there were some strange cases in there, which we didn't find really any other cause of signs. It could have influence on hemodynamics, but that's unknown. There's also some discussion on metastasis via vertebral venous plexuses. Maybe this anomaly influences the risk of metastasis in lemur vertebrae. And of course, as I mentioned, if these dogs, which are commonly presented with other vertebral malformations, which could need some form of stabilization, where would you put the screws in this vertebrae if it has a large hole inside it? This would definitely affect the number or the size or the trajectory of the screws you're planning to implant. So definitely relevant in that respect. Limitations of the study, of course, briefly, it's retrospective. The parameters of the scannings were not recorded for all of these cases. Limited number of dogs involved. Inclusion of only 2 breeds, could be that more breeds are affected. And cases, well, of course, there is a bias for selection of the cases. We just asked clinicians, have you seen this? And of course, they will remember the most severely affected ones. Apparently, all were English bulldogs. The overall prevalence of the anomaly in the canine population is unknown at this point. The English bulldog's predisposition we found in our study should be confirmed by future studies. There's no morphometry or quantitative data. We just described and devised a classification system which may or may not be useful for future studies or could be improved. And the use of CT or MRI angiography or venography would be useful to describe this in more detail, and also post-mortem studies to describe what exactly courses through those canals. So in conclusion, we've described yet another vertebral anomaly in bulldogs. CT and MRI characteristics are now described. Clinical relevance is possible, at least as we discussed, and the causation of these malformations are unknown at this point. So I'd be happy to answer any questions, if there are any.
Thank you very much, Koen, and again, great presentation and certainly an excellent, study. We've all seen this kind of, malformation, and probably didn't make too much of that. And it's nice, obviously, to have, a clear description of what we think. Before we go on to question, and it gives time as well for people to pose them, just wanted to make a call for any, resident or young neurologist that wish to present, like Koen has just done, their study. Please contact us, via the Facebook Messenger. We created this platform, Simon and I, with the help of Hallmark, with sponsoring tonight, to give a platform for young neurologists to showcase what they're doing. It's not really, Simon and I, it's not the role of old geezer like us, to do that these days. But we want to offer that platform for everyone else. So if, you want to do that, please contact us, and, we put you on the rota for the next presentation. Let's look at some questions. There is one from Miroslav. I'll let you read it, regarding whether or not there was, comorbidity associated with finding this vertebral canal anomaly.
Yeah, good question. As I said, there were some strange cases in there for which we didn't find any other causes of clinically neurological signs. In the English bulldogs, which we did pathology on, it was really unsatisfying because the dog was repeatedly non-ambulatory, and we didn't find anything on the MRI regarding the spinal cord. We only found these strange things, and it happened at least 3 times. The owners elected euthanasia. We did post-mortem studies, but we didn't find any really convincing signs of spinal cord pathology. So unknown if maybe vasculature or supply or drainage affected clinical signs in these dogs. And in the other cases, we didn't find any other pathology specifically related to the location. And there were multiple locations of these anomalies, as you could see in the tables. So no signs of correlations for now.
There's another question for Miroslav, and you notice that Miroslav is wearing a nice T-shirt on his profile picture.
Study the human analog. Well, I looked at literature describing vertebral vascular canals, and I found some morphometric studies. There are some, so I mentioned the eponym of the Hahn canal or Hahn's canal, and you can apparently have bigger than normal Hahn canals, but I couldn't really find any specific literature on the relevance or other descriptions. So it seems to be sort of a radiology thing from the past. They did more radiography in the past, and sometimes they were mistaken. So that's clinically relevant as well. They were mistaken for fractures. I've seen that happen as well, because vascular canals in larger animals can look pretty large. So I saw a CT scan of a bear, which was suspected to have a lumbar vertebral fracture, which was concluded to be the vascular canal. So those are just some things I found.
Let's take a couple more questions. This one relate, I can summarize it. Did you look at other dysmorphia in this dog, especially the Italian one, with regard to head conformation and so on, but could match finding this vertebral canal malformation, vascular canal?
No, we didn't, but it is an interesting thought. Let's say maybe the entire population also has less dysmorphic features in other parts of the body, so the head, maybe that affects prevalence of this. So actually I discussed also a little bit in the article. There's a small paragraph about the term brachycephalic obstructive syndrome, and maybe expanding that to just calling it bulldog syndrome because it's breed specific, and then including all other types of dysmorphias affecting clinical presentations. So it's definitely worth looking at this at a more bigger picture, and maybe everything's involved. Maybe all those vertebral malformations are somehow linked, which is not unlogical, I guess.
Have you seen any anomaly in any other breed at all than the one you mentioned?
I saw it in pugs. Also, we didn't include them in the study, but I've seen it since. We've also seen it retrospectively on studies of other species, etc. Cats. We've seen it in cats. We're describing this as well. And basically it could happen, I guess, in multiple species and breeds, but we either overlooked it or didn't pay attention to it, or paid attention to the clinically relevant stuff we found and disregarded this feature. And it would be good to raise attention to this, that this is at least not normal, because if this somehow gets worse in the population,
I'm sure we pay more attention. We pay more attention from today. Last question from Fernando. You say there is fat inside the vertebral bone defect. Why the disease name is vertebral vascular canal?
Yeah, so the bony canal is dysplastic, and it's filled up with whatever it's filled up with, and of course there's not air, so fat is a logical thing to be deposited there. It's either that or the venous plexus, which could be severely enlarged, but that wasn't the case. So.
Very good. I think we'll probably call it a day because of the time. Simon, you have the last word.
Yeah, thank you very much, Koen. That was very nice. Not only have you described and brought attention to this anomaly, but you've now nicely set it up for future work. So yeah, excellent, and thanks for giving up your time. Should make it clear to people that Koen has also volunteered his honorarium for this to the ongoing crisis in Ukraine. So thank you very much, Koen, for that exceptional gesture. Thank you very much to everyone who's attended. Thank you to Hallmark for sponsoring this second Facebook Neurology for Vets Journal Club series. Our next one will be in the first week of June. So if you do have anyone, or if you do have a publication coming out or has just been published that has some imaging in it, MRI imaging, please get in touch with us. We would like to give you this platform to discuss your work and get this information out there. So thanks very much to everybody, and tune in next time.
And especially if you are from a town that is impossible to pronounce, please contact us, because
I will make it worse.
Listening to Simon sweating to try to pronounce it is just a pleasure. So please, please contact us.
And even if you don't, just make it up.
Thank you again.
Thank you.
Thanks. Good. Bye.
All right.